Hello, Miss Howard. So today I'm gonna be interviewing Miss Maya from high school. So yeah, I'm just gonna go ahead and start with the questions. Miss Maya, how are you?
Good. How are you?
I'm doing great as well. So I'm gonna start with the first question.
Okay.
What was your major in college, and where did you study your undergraduate degree?
Okay. So I studied clinical psychology at the Universidad Católica here in Asunción. It was a 5-year career. Mm-hmm.
And have you completed other undergraduate studies besides your undergrad?
Yeah. I mean, not completed, but I started an English major at the Universidad Nacional for 2 or 3 years. And then because there was so much work to do for clinical psychology, I ended up not finishing it, deciding to quit.
And do you think this, like, you would probably pursue this in the future as, like, you would try to finish that degree?
Maybe. I think it was something that I really liked. Okay. But I don't know. I wanted to be a translator. So that's why I pursued that, and I also loved education. So my initial plan was also to teach English as a second language. So yeah, I think I already implemented some of the things that I learned here because I work in a different language. But yeah.
Okay, so the next question is, are there any specific licenses that you had to get or exams that you had to take to work as a psychologist?
So I had to do practicums with real patients at a public hospital, several hours. I had to do some other observations as well, but that was for the undergraduate. They're not postgraduate. I did my postgraduate at Edinburgh University in global mental health.
Okay, so these next questions are more about actual psychology.
Okay.
So I'm gonna start with this one. Which psychological approach do you, from the four, do you use at school? Behavioral, humanistic, cognitive, or psychodynamic? Do you use with students at school?
With students. I think for most of my job, I use cognitive behavioral therapy. Like restructuring the thoughts, being able to just identify cognitive distortions, other strategies, but also the humanistic approach. I feel very identified with that approach as well. So a bit of a both.
A bit of both. Okay. So can you give an example of if you use any of these classical conditioning or operant conditioning in your work?
So in my work here at the office, not so much, but when I teach, for example, I give a stimuli, which is my hand up on top. So I expect students to identify that and follow, be quiet and sit down. So I think that's the way I use that.
Not so much with students here in your psychological part, but to help them learn behavior-wise.
Behavior-wise, maybe identify a internal stimuli in their body. So for example, when I'm becoming anxious, my hands are getting sweaty, right? And I identify that and then try to match with some sort of strategy that they learned in order to respond to that stimuli that is making them uncomfortable. Maybe that could be the case. More identifying parts of their body that they're feeling stuff.
Now this next question is more related to I think school and teenagers.
Okay.
So it's how's the brain and neurotransmitters affected by substance abuse like alcohol or smoking?
So students always try to do exciting things, right? And they're always trying to transpass the limit. And that's a normal thing that all adolescents and teenagers have. But I think alcohol and also smoking, vaping, and stuff like that, they just raise their level of dopamine, and the baseline, it's not enough. So they're always and constantly are looking for that excitement, for that I'm feeling great kind of feeling. It distortionates what they really need to be doing or need to be performing during their teenage years.
And do you think there's alternatives instead of smoking or alcohol or all that stuff to raise your dopamine levels in a like natural way?
Yeah, for sure. I mean, we are very sports driven school. Some people get that dopamine and that sense of like serotonin, serotonina, playing sports. Some of them really get that feeling playing some music or doing art and finding that state of flow of like I'm doing what I'm liking and I feel good at. So it's a bit of a combination of my abilities is also meeting how I'm feeling and then how challenged I'm being like in this situation. So yeah, sports, ways like positive ways of having fun, meeting with friends, music. I think that's also a very healthy channel to go through stuff, even if happy moments or sad moments.
So how do childhood experiences affect mental health?
So based in the psychodynamic theory, they're basically what shapes us, right? I like to believe that they do. Our early experiences, they do shape us, but we can also restructure them and adapt them to our perception of the world and how we are. So basically how much people nurture you, what's your kind of attachment, right? What you've been receiving and going through, or how you felt in those very early years, right? Because your brain is still developing and you're learning things from the world. And okay, so this is what I'm expecting. Like if I expect my mom to be away from me most of the days, then in my teenage years I would expect my fiance or my husband to be away for most of the time. And
So building off that, how often do you see like specific psychological disorders, like let's say anxiety or depression at school or like in students?
I feel like nowadays, because of technology, anxiety has risen up a lot.
Social media.
And social media as well. People are edgy. People are so used to having things right away, right? So when you don't have that, then people get anxious because they're waiting for that to happen. So I think almost 60 or 70% of the students I meet with have some sort of sign of anxiety. Depression, yes. Also, not as much. I would say anxiety is
the main one.
The main one, yeah.
And how do you like diagnose these disorders in students, and like how do you treat these like at school?
So at school, I don't do any kind of diagnosis from here. Although I'm licensed to do some sort of diagnosis, I cannot actually do it. We used to work here as if I see any signs, or if teachers see any signs, they would send me a G-chat. I'll try to work it out with kids. But if not, and if it's and we have like constant reappearance of signs, I would then recommend the student to go to a therapist, and then start up a process of evaluating themselves, getting to know a psychologist or a psychiatrist or whatever they need outside of school, and then I will work collaboratively with the therapist from outside to look for strategies for them to have here in school, right? I'll be some sort of like extra support, not the main source of support when students already have a diagnosis, right?
Yeah. Okay, so speaking of that, how does like your average day at work look like?
So, I come in at 7:30, right? I basically plan my day. I'd see if any students requested to meet with me the day before and I didn't have enough time to meet with them. Weekly, I have 2 to 3 meetings with staff to discuss about students proactively. Once a quarter, I teach lessons. So whenever I'm teaching lessons, most of my day is like going into classrooms and giving the lessons. But yeah, it's mostly one-to-ones, and during break or lunch, maybe small groups. So when people come in and they have a group dynamic situation that they need to fix as a group, they would come during recess or lunch, right? And I end up my day and I go to my private practice.
Does that group of students that usually come in, is it mostly girls or mostly guys?
Mostly girls, for sure. Mostly girls, yeah. boys will come in, but basically because they were referred from a teacher because of behavioral situations, which I don't like to discuss or address sometimes, or they're more like a consequence kind of conversation, and this is right or wrong. It's not what I do. But I do also like to talk about like moral and how they felt that was correct or not to receive that consequence. So that kind of like the aftermath of whatever behavioral consequence they have, they come to me.
So girls are usually more emotional things, and guys are usually like.
I think girls are most likely to come in as a group and expose and say like, this is bothering me. But I do have other boys who come in like, casually because they don't want to like talk about their feelings first, and we talk about, I don't know, soccer or what they did at a party, and then they will slide in the topic of conversations that they really want to talk about. It's just very different. But I do have boys that are sentimental and emotional and also struggle and feel good like coming here. So yeah, but majority girls.
Yeah. So this is almost the last question. So what is the most rewarding part of your job, and also like what's the hardest part of your job?
So I think the most rewarding one would be connecting with kids, right? Having the privilege to hear your voices and your stories, and I know that some of you, well, it's normal that being a teenager, you don't feel very comfortable talking to your parents about stuff. So I feel like if they're willing to talk to me, I'm like a safe adult. I'm happy to be that person, and I'm very honored and grateful to have that trust with kids. And the most challenging part is definitely the child protection cases that I have to deal with, of course, right? Hearing those stories, supporting those most challenging cases. Yeah.
So this is my last question. So what would be your advice for students interested in AP psychology?
I love psychology. I could never think about studying anything else. Like I don't regret it. I'm very proud of my choice in terms of studying a psychology undergrad. I believe understanding the mind and how we socially interact with one another, it just gives you a lot of information in order for you to be successful in life. Leaving aside disorders, leaving aside theories, right? And yeah, it's a very interesting subject. And yeah, as long as you organize and you're a little bit curious, then I think they will enjoy.
Okay, thank you very much.
Yeah, thank you, Elias.